Hi class, my name is Carissa Burnell, and today I'm going to present to you speech 3 based on an informative speech. Now I'll present to you my audience. Hello ladies and gentlemen. Let me begin by asking you one thing. How well do you believe your child can see? Some of you might have been hesitant to answer that, or some of you might have answered right away. They can see perfectly fine. Well, let me begin by telling you that you might want to consider a visit to the ophthalmologist. My name is Carissa Burnell, and I currently work at Rady Children's Hospital as an ophthalmic technician. Today we are going to talk about 3 different types of amblyopia. One of them being refractive amblyopia, the second one being strabismic amblyopia, and the third one, deprivation amblyopia. Some of you are wondering, what is amblyopia? Well, in a quick explanation, amblyopia is a decrease of vision in one or both eyes due to abnormal development in early childhood. Some of you might even have it now, and some of your children might have it now without you even knowing. Let's begin with refractive error amblyopia. To some, refractive error means the power of the lenses or current glasses you wear now. Refractive amblyopia means that your child may not be able to see in 1 or 2 eyes because that eye is currently not seeing well. What this means is that the brain is shutting off that seeing of that one eye because it's not getting a visual. Think of it as a camera. When you take a picture, that picture sends it to your brain, and your brain makes it look as the picture you're seeing. Well, let me tell you that when you have that refractive amblyopia, that one eye, it's not sending a correct image to your brain. It's sending a blur, a spot, something that not even glasses can fully correct at times. That is a mild explanation of what refractive amblyopia can be and how it can affect your children. Second, let's talk about strabismic amblyopia. Some of you might say, what's strabismus? Strabismus means a misalignment of the eyes. Not necessarily the eyes, but as we all know, we have muscles in our eyes. Strabismus means that one or the other eye can be either drifting in or drifting out. They are misaligned. So what happens when one eye is misaligned? Automatically, that eye is not seeing correctly. Think of it as your eye wandering off. Is that eye sending an image to the brain? Is that eye seeing correctly? We can all agree to say that it's not. So strabismic amblyopia definitely does cause a decrease in vision because that eye is not seeing. A lot of pediatricians miss it because you can see perfectly with the other eye. And then to many parents, that's normal. My children are seeing well because one eye is doing all of the work. But strabismic amblyopia can be a bit more noticeable because you can see that misalignment in the eyes. You can see the drifting and the inward precision of that eye. Third, we have another type of amblyopia that to some of you might seem something that it can't be caused, but it definitely can. This is called deprivation amblyopia. Along with many other diagnoses, deprivation amblyopia can be caused by glaucoma, by cataracts, and believe it or not, by many hairstyles. Let me tell you a quick story real quick about a patient we had. This little girl was 4 years old. Mom came in and she was perfectly beautiful with her hair covering one eye. She was perfectly styled well. But then as we went ahead and checked her vision, we came to notice that that eye that was being covered all this time with that beautiful hairstyle was not seeing. So you might think, how can a hairstyle cause this? It definitely can. Deprivation amblyopia, what it's causing that eye not to see well. You're making it not see well. As I mentioned, glaucoma and cataracts can cause that. Why is that? Glaucoma damages the nerve, which is the kind of the signal that sends that image to the brain. So that nerve is not letting that eye work. forcing your eye not to see well. Cataracts. Have you guys ever heard about a window being dirty? Cataracts cause that. The lens in your eye tends to be dirty. So a lot of kids are born with cataracts, and a lot of kids can't develop that vision. Why? Because they're being deprived of this. They're being deprived of this vision. So yes, that hairstyle that I mentioned earlier does deprive that little girl, and it did. It deprived her from her vision. Why? Because automatically that eye was being occluded for maybe 3 years and so on now. Mom didn't know. Unfortunately, these are one of the things that can cause this refractive error, this amblyopia. So let me tell you this. I want to say that whatever is being said cannot be and should not be used as medical advice, as I am not a physician. But then you might think, is my child really seeing correctly? I advise you to get an opinion and to, yes, take your children to see an ophthalmologist. Because you can say, my child sees perfectly fine. He sees that airplane. Is he really seeing an airplane, or is he seeing just a blur or a spot? Going back a little bit to the types of amblyopia, how can we fix it? How can we make our children see correctly? Besides going to that advised medical ophthalmologist visit, once they are diagnosed, there is some things we can do. There is things that can help this vision improve. Glasses might be one of them. Although glasses tend not to do the full potential and correct that refractive error that has been gone. Because once it's gone, it's hard for it to come back. So yes, glasses can definitely help up to a certain potential. What do we do next? We tend to patch the eye. What do you mean patch? So what we do is you occlude the lazy eye, the eye that is not being able to see correctly. Why is that? Because we are forcing that lazy eye to see correctly. So you want to occlude the other eye so this eye can work to its full potential. So that eye can get the brain used to it seeing correctly. So that eye can come to its full potential and be able to see clear. Give your child that clear image that he's not been able to see. Yes, glasses and patching can help, but you want to go ahead and take care of this before your child is 9. Why 9, you might say? Because a lot of the times a 9-year-old can develop its full potential vision at that age. Whatever has been lost before those 9 years, it can potentially not come back. So we advise that you do get your child into an ophthalmologist visit, and that if they are 9 and that they do suffer from amblyopia, there is things you can do, but have in mind that not everything can always come back. Thank you and have a wonderful day.